Like every IVF clinic, we're very proud of our IVF success rates. We do an extremely good job. We spend a lot of time and energy on our patients. We make sure that we provide them with top quality care. We make sure that they understand what we're doing, why we're doing it. We give them photographs of their blastocysts. We document all their journey. But you know what? There are two more things in our IVF clinic which I think are unique to our clinic, which we are even more proud of. One is we're very proud of the fact that our patients are very well informed. We spend a lot of time and energy, whether this is in the form of emails or consultations or face to face time or videos or website articles, so that patients know exactly what's going to happen to them during their IVF journey and why it's happening. We find that this way patients are in control of their IVF cycle and that patients understand that the outcome is not in anyone's hands, but the process itself should be a happy and a positive one. And this way, well informed patients are a blessing for good doctors because this way doctors and patients can form a partnership and that patients are happy with the quality of treatment they've received. Not only are we very proud of the fact that our patients are well informed, this also means that no other IVF doctor can take them for a ride, which is obviously good for these patients. The other thing we're very proud of is we reduce the stress levels in our clinic. We take pride in being kind to our patients. We don't outsource their care to a junior doctor or to an assistant. We're very hands-on. We're a boutique clinic. We limit the number of patients we see because we only have two doctors in our clinic, Dr. Anjali and me, and we only have one senior embryologist, Dr. Sai. And because we need to take care of all our patients, we spend a lot of time and energy in making sure that the chances of each of these patients getting pregnant is maximized. All our care is very customized, very hands-on. We don't do unnecessary tests. We don't waste their money on PGD and ERA tests, and we don't give them useful, painful injections which don't help at all. Everything we use is very, very targeted, so they know what's happening and why it's happening. That's what we take pride in.